here's a couple of things I know about therapy. I guess the 10-minute option is like making me super talkative. The first is that a lot of the work actually does happen outside of the therapy room and outside of the session. A lot of the work happens in the session. But the fact that it happens outside of the session does not mean it happens without the therapist. Like, I am dialoguing with my therapist in my mind all the time. Like, we're in a constant, in my mind, conversation. I also am in like conversation with my clients throughout the week. I have them internalized, and I hope they have me internalized. And the work of being in relationship in between sessions is actually a lot of the work. And coming back to like all of the things that each of us were holding throughout that week and reconnecting around them and finding alignment and attunement around them is like a really big part of what ends up being healing. In addition to that, I think it's really important that you know from your therapist that your inner child or children or multiple stages of your developmental selves are invited into the room. You're not supposed to show up to therapy totally together as your perfectly presented adult self. Like, there's got to be a 16-year-old that comes to the session. There's got to be a 12-year-old that comes to the session. There has to be room for that person. And you can ask to be invited in, or you can say you need an invitation in, but the more versions of you that are present in the therapy, the more versions of you will heal and integrate and become whole. The other thing is that I truly believe that the past does make itself known in the present, and that part of our work as people, just as humans, is to try to figure out what's what so we can actually live in the present and be working out the past, and also manage our triggers so that we can like show up for life. And what's really important for that to happen is that the trauma, at least in some way, comes into the therapy. Whether it's that you're feeling anxiously attached to your therapist because your trauma has resulted in an anxious attachment, or whether you're feeling avoidantly attached, or whether there's secrets you want to keep, there's got to be some way that there's elements and dimensions of the trauma that enter the therapy relationship. Not that you actually relive it or have to go through a total reenactment or even exploration of every single thing that happened to you, but you do need to have parts of who you've been come in and like disrupt the presentation you have to the adult world on a daily basis. Like, there's got to be something about your life that disrupts the presentation of how you are outside of session. And there's a plane going by, but I'm not going to stop talking because I guess I have a few more things to say, so sorry about the noise. The other thing about therapy that I think is like super important is I think your therapist should know what makes you laugh. And it's really cool if your therapist also knows how to make you laugh, because humor and joy are two of the hardest things to retrieve after having survived trauma. It's just really hard to get those things back. So if you're in a therapeutic relationship where you can actually like experience joy and laughter, and there's like connection and inside jokes and ways that you guys know how to touch each other, not physically, but like know how to touch each other's souls, there's also healing in that. And just in that 45 or 50 minutes once a week or twice a week, that level of attunement and deep knowing of each other, also combined with being in dialogue with each other throughout the week, though not literally, through the internalization process, are some of the steps it takes to start living life more fully. And it's part of the mystery of like how this whole thing goes down.